Good afternoon, ladies and gentlemen. I'm happy to introduce the GREMTIC MIP MIFIS webinar, MIFAS. And this is about the role of endoscopy in Achilles tendinopathy, and you are very welcome. And I understand that we have approximately 350 attendees. My name is Jon Karlsson. I'm from Gothenburg, Sweden, and I'm very happy to be your host today. Thank you, Mickey, for inviting me. We are also very distinguished lecturers today. I will introduce them in just a minute. This organization, you can see the website at the top of this slide, www.grecmip.org. They're doing courses, congresses, they help you with research grants. There's a PhD program, e-learning platform, PowerPoints, webinars, as this webinar today. You can ask the expert, etc., etc. There are many, many things to do. So, doesn't cost anything, become a member today. There are clinical cases on Facebook, follow up on social networks, Instagram, LinkedIn, etc. There's a scientific group, foot and ankle group of research and study in minimally invasive surgery. So we move on. As I mentioned, I am Jon Karlsson from Sweden, and I'm the moderator today. And I'm happy to be moderating this session. We are aiming for approximately 2 hours with first of all, 3 distinguished speakers. And the first speaker is Nicola Mafulli, talking about the basis and the treatment of Achilles tendinopathy. Second speaker is from Portugal, Nuno Corte Real, with endoscopy in insertional tendinopathy. And finally, Hajo Terman from Germany, from the Atos Clinic, is going to talk about endoscopy when it comes to treating chronic Achilles tendinopathy. So there are some basic rules that we have to stick to. We have approximately 15 to 20 minutes for each speaker, but it doesn't really matter. We a little bit shorter, a little bit longer. It's very important that the microphones are muted for all participants, because then we will have much better sound. We would like to have some discussion. So please use only the question and answer tab and not the general tab to make your questions. We will see your questions after all 3 speakers are done. We will just have 1 or 2 questions in between and all 3 speakers, and then we will probably have around 1 hour for questions and answers. Specific questions for each speaker will be answered after each speaker's presentation. General discussion will be at the end with involvement of all speakers, and maximum duration of the session is 2 hours. Don't be shy. Speak out. We are here for you. We would very much like to do this as well as we can. It may not be perfect, but it will definitely be good. So with good collaboration, many questions, good answers, this will be a terrific afternoon. So I'm done with my opening. So the first speaker is Professor Nicola Mafulli. So I think, Nicola, you can take over and present yourself and go on with your talk.
Good afternoon. Jon, I think that you need to stop sharing.
I'll stop the share now. Okay.
Thank you very much. So it's
my
turn to start sharing.
Okay. And I think that at the end of your talk, you need to stop the share screen.
Yep. Good afternoon, everybody. It's a great pleasure to be here, and let's see if we can start things going. Okay. I've been involved with the GRECMIP for the past 12 years. At one stage, I was the scientific secretary. And some of my research rolls around tendinopathy, and especially Achilles tendinopathy. It is a great pleasure to be here today with some of my good friends. With some of them, we have written books and entertained papers together. And and we are all actively involved in Achilles tendinopathy and such problems. One thing that I would like to share straight away is the fact that pain at and around the tendon is not necessarily an overuse injury. And as we have developed a special interest in these conditions, please remember to have very high in your list of differential diagnosis arthritic conditions and some less common causes of pain at and around the Achilles tendon, such as infection, neoplasm, xanthomatosis.